Welcome. Today, our dear friend Tim here is going to help us walk through what a neuroemotional technique would look like in a clinical setting. So, Tim, what is our stressor today?
My son.
Your son.
Yeah.
Okay, so think about that stressor in relationship to your son. We're going to look for a strong arm initially, and then the stressor in relationship to his son should go ahead and weaken that arm. Okay, so think about that stressor in relationship to your son, and we're going to look for a point here that strengthens that. That is going to be, let's check the concept of fear, let's check the concept of paralyzed will, let's check the concept of dread. Okay, so can you get that idea of the concept of dread in relationship to your son?
Yeah.
Okay, so I want you to think about that. Excellent. Then what we're going to do here is we're going to take this hand, bend it right here, and you're going to take this hand just like this up underneath. You're going to hold just like this. You're going to put that on your forehead. You're going to lean forward for me. You're going to think about that picture and that image of dread in relationship to your son. I'm going to do some tapping here. Breath in, out, breath in, and out. Just hold that picture. Breath in and out. Good. Now, you can go ahead and put your arm down here. Okay, and we're going to recheck again. We're going to see that when you think about your son, right, you're nice and strong now in comparison to when we started, right, that dread with your son. So as we recheck it again, it's fine. Now, we're also going to double check and see if we need a little bit of a spray. So I'm going to go ahead and put 2 fingers here, and that still comes up in relationship to your son. So what we're going to do is we're actually going to have you go ahead and do about 5 sprays of this. Good, excellent. Now, we're going to check again that dread in relationship to the concept of your son. We're going to check the points here on your face again. We're going to check another point. We're going to double check and make sure there's no additional hidden points. So what we're going to do, Tim, is we're going to have you take that water spray, 10 sprays, 3 times a day until the bottle's gone. All right, any questions?
Nope.
All right, thanks, Tim.
Thank you.